Hello, my name is Dr. Michelle Talukder. I'm a second-year pediatrics resident at Children's Hospital of Michigan. The title of my project is The Comparison of Severity and Outcomes of New Onset Diabetes Before and During COVID-19 Pandemic. What we do know at this time is that the SARS-CoV-2 virus can affect many organs in the human body. We know that it can especially affect the pancreas. We know that the SARS-CoV-2 virus can affect the ACE2 receptor in the pancreas, leading to apoptosis, impaired insulin secretion, and diabetes mellitus. Adult studies have been done showing that the SARS-CoV-2 infection is associated with an increased rate of new onset diabetes, along with an increased rate and severity of DKA. However, what we don't know is the exact impact of the SARS-CoV-2 infection on new onset diabetes and DKA in children. The aims of this project was to compare the clinical characteristics, severity, and outcomes of new onset diabetes before and during the COVID-19 pandemic. We wanted to determine the risk factors associated with severe DKA during the pandemic. We chose a retrospective study design for this project. We chose children less than 18 years old diagnosed with new onset diabetes in the pediatric emergency department in the pre-pandemic period, consisting of March 1st of 2018 to the end of February of 2020. And the post-pandemic period consisted of March 1st of 2020 to the end of February of 2022. We excluded patients with the SARS-CoV-2 infection without either DKA or diabetes. Known diabetics with hyperglycemia but without ketoacidosis were also excluded. And finally, kids who returned after a recent diagnosis of new onset diabetes was made were also excluded. We defined DKA as mild, moderate, and severe. Mild is a pH less than 7.3 or a serum bicarb less than 15. Moderate is a pH less than 7.2 or bicarb of less than 10. Severe is a pH less than 7.1 or a bicarb less than 5. SARS-CoV-2 infection was diagnosed as a positive RT-PCR antigen or serology. Severe outcomes was defined as any one of the following: death, requirement of mechanical ventilation, non-invasive ventilation, or requirement for hyperosmolar therapy. Statistics was done using continuous data by the median's IQR, categorical as proportions. Data was compared using the Mann-Whitney U and chi-square tests, and p-value less than 0.05 using a 95% confidence interval was considered significant. Logistic regression was performed to determine risk factors for severe DKA. 366 children were analyzed in this study. In the pre-pandemic period, there were 200, while in the pandemic period, there were 166. As you can see in my table 1, there were no differences in the rate of new onset diabetes or type of diabetes. Additionally, there were no differences in the median age or race. Also, there was no difference in the rate of severe DKA. However, the rate of DKA itself, the need for hyperosmolar therapy, and the rates of severe outcomes were significantly different between the two periods. What is also noted is that the median bicarbonate level in the pandemic period of 13.5 was lower than the pre-pandemic period, and the same for the blood pH, where in the pandemic period it was 7.29 versus the pre-pandemic period of 7.37. The beta hydroxybutyrate was higher during the pandemic at 71.1 versus the pre-pandemic of 31.6. These results were all significant. Multivariable logistic regression analysis revealed that the BUN and PCO2 levels at presentation were significantly associated with severe DKA, while the pandemic period and SARS-CoV-2 positivity were not. The limitations to this study include that it is a single-center study, so therefore the results cannot be generalized. Very few children tested positive for the SARS-CoV-2 infection, and the definition of severe outcome is not standardized. Also, the fact that it is a retrospective study means there's limited data availability. We conclude that although diabetic ketoacidosis rates in new onset diabetes increased, the severity remained unchanged during the pandemic. Severe outcomes and the need for hyperosmolar therapy were higher during the pandemic. Lastly, elevated serum BUN and low PCO2 levels were associated with severe DKA. Thank you for allowing me to make this presentation. I would like to thank Dr. Setyarman and Dr. Rupa for being my mentors in the pediatric emergency department, my co-resident Cynthia Ukafore, medical students Paige, Kennedy, and Joshua, along with our statistician Anuj. And lastly, I would like to thank Priya Spencer, the research coordinator in the emergency department.